part of arm and radial nerve. Triceps brachii. As the name suggests, this muscle is made up of three heads. Tri meaning three and ceps meaning heads. Since it is situated in the arm region, which is also known as brachium, the muscle is named as triceps brachii, three-headed muscle in the arm. Origin: the triceps brachii muscle consists of three heads: long, lateral, and medial head. The long head of triceps brachii originates from the infraglenoid tubercle of the scapula. The lateral head arises from an oblique ridge in the upper part of the posterior surface of the humerus. This oblique ridge corresponds to the lateral lip of the spiral groove. The medial head originates from the posterior surface of humerus, from a triangular surface below the radial groove. Few fibers of the medial head arises from adjacent lateral intermuscular septa and medial intermuscular septa. Insertion: the long and lateral head unites to form a flattened tendon which inserts in the posterior part of superior surface of olecranon process of ulna. The medial head is partly inserted into the flattened tendon and remaining part directly inserts into the olecranon. Nerve supply. Triceps brachii is supplied by radial nerve. Root value of fibers supplying triceps muscle is C7, C8. Each head of the triceps receives a separate branch from the radial nerve. Long and medial head receives the branch when radial nerve is in the axilla. When radial nerve passes in the spiral or radial groove, it gives branches to lateral and medial head. Thus, the medial head receives an additional branch from the radial nerve. Actions. The triceps muscle is the powerful active extensor of the elbow. Long head of triceps supports the head of the humerus during abduction movement at the shoulder joint. Radial nerve. Radial nerve is the largest branch of the brachial plexus. Origin: radial nerve arises from the posterior cord of the brachial plexus. Root value: radial nerve carries fibers from C5 to C8 and T1. Course: radial nerve arises from the posterior cord of brachial plexus in the axilla. At its origin, it is situated posterior to the third part axillary artery. Then, it courses downwards posterior to the brachial artery. It then enters the lower triangular space and reaches the spiral or radial groove on the posterior surface of humerus. It descends downwards and laterally in the radial groove. Once it reaches the lateral side of the arm, at about 5 cm below the deltoid tuberosity, pierces the lateral intermuscular septum and enters the anterior compartment of arm. It courses down in front of the lateral epicondyle and enters into the cubital fossa. Termination. The radial nerve terminates in the cubital fossa by dividing into superficial and deep branch. The deep branch of radial nerve is also known as posterior interosseous nerve. Relations. Relations in the axilla. Anteriorly related to the third part of axillary artery. Laterally related to the axillary nerve and coracobrachialis. Posteriorly related to subscapularis, above by teres major and latissimus dorsi muscle. Medially related to axillary vein. Relations in the upper part of arm. Anteriorly related to the brachial artery. While passing through the lower triangular space, it is related to the teres major, long head of triceps brachii medially, and shaft of humerus laterally. Relations in the radial groove. In the groove, the radial nerve passes between the medial and lateral heads of triceps brachii muscle. The nerve is in contact with surface of humerus. Branches. Cutaneous branch of radial nerve. Radial nerve gives branches to the long and medial head of triceps brachii when it is in the axilla. In the spiral groove, it supplies lateral and medial head of triceps and anconeus muscle. It gives proprioceptor fibers to the brachialis muscle. In the lower part of arm, it gives motor branches to the brachioradialis and extensor carpi radialis longus muscles. Cutaneous branches of radial nerve. Radial nerve gives posterior cutaneous nerve of arm in the axilla. This nerve supplies the skin on the back of the arm. Radial nerve gives lower lateral cutaneous nerve of arm and posterior cutaneous nerve of forearm when it is traversing the radial groove. Branches. Radial nerve provides articular branches to the elbow joint. Profunda brachii artery is the branch of the brachial artery. It rises just below the teres major muscle. Along with the radial nerve, it leaves the front of the arm and enters the radial groove. It terminates by dividing into anterior and posterior descending branches which take part in the anastomosis around elbow joint. Branches. Radial collateral artery, also known as anterior descending artery. It accompanies the radial nerve and anastomosis with the radial recurrent branches of radial artery in front of the lateral epicondyle of humerus. Middle collateral artery, also known as posterior descending artery. It ends by anastomosing with the interosseous recurrent artery branches of posterior interosseous artery. Ascending deltoid branch. It ascends between the long and lateral heads of the triceps brachii and anastomosis with the descending branch of the posterior circumflex humeral artery. Nutrient artery to the humerus is sometimes present. Anastomosis around the elbow joint. The movements at the elbow joint kinks the brachial artery that is passing in front of the elbow joint. Through this will not compromise the blood supply to the forearm and hand. If there is any kind of obstruction in the brachial artery, blood supply will be definitely impaired. To overcome any possible obstruction in the brachial artery, a rich anastomosis is present around the elbow joint, which acts as a communicating link between the brachial artery and profunda brachii artery with ulnar and radial artery. In addition to acting as a collateral channel, this anastomosis supplies the ligaments and bones of the elbow joint. The anastomosis is formed in anterior and posterior aspects of the epicondyles of humerus. Anterior to the lateral epicondyle. Anterior descending branch or radial collateral branch of the profunda brachii, anastomosis with radial recurrent branch of the radial artery. Posterior to the lateral epicondyle. Posterior descending or middle collateral branch of the profunda brachii artery, anastomosis with interosseous recurrent branch of posterior interosseous artery. Anterior to the medial epicondyle. Inferior ulnar collateral branch of brachial artery, anastomosis with anterior ulnar recurrent branch of the ulnar artery. Posterior to the medial epicondyle. Superior ulnar collateral branch of brachial artery, anastomosis with posterior ulnar recurrent branch of the ulnar artery.